Gina, this is so great. Thank you for being here, and it was such an honor to serve
as your son. It's like the team's back again.
I know. So, and I remember my job interview. I wasn't nervous at all, and we talked about public health, your background in public health, and me being a public health professor. Tell us about that message.
Well, one of the reasons why I actually wanted a public health person is even though it's called the EPA, the Environmental Protection Agency, it's a public health agency. It's about science. It's about evidence-based decisions. That's what we do for a living.
Well, let's talk about science a little bit, because you weren't always happy with the science I had to bring forward to you.
It's true. I didn't like you many of the times that you came to see me. Only because when people give you, like, facts, real facts, you actually have to act on them. And that's what science does for you. It basically defines what the risks are. It helps you design solutions that can work. It drives innovation. You know, science matters. Science is fact. It's not a religion. So as much as I want to deny you entrance into my office, I did never deny the science. You have to consider it, and you have to protect the science and the scientists that are doing their jobs, especially at EPA, who some are out there. We love you. We support you. You're doing great work. We'll get back to facts soon.
Shout out to CDC, too.
Yeah, CDC.
Well, speaking of science, the National Climate Assessment, the Lancet report, all the work you did on the Paris Agreement to lay the groundwork for the U.S. being the world leaders in climate. We got to talk about this a little bit.
A lot, actually. Well, you know, climate is really the greatest public health threat of our time. I think we have made a big mistake in thinking that we're selling it as an environmental problem when the planet really doesn't care if it's warming. We care if it's warming. So climate is all about a direct threat to ourselves. And mostly it's about a threat to our children and what kind of a future we want to leave them. And so you have to look at the science. You have to understand that there are actions we must take now. Now, you saw the IPCC report, the most recent report on the National Climate Assessment that looks at regional impacts, and you looked at the Lancet countdown report. And the exciting thing is they all included health. It's about time. Right. They started talking about the health challenges we're facing today. You know, one of the things that Tom and I were going to make you do, because we really like Bloomberg, is to get you all to stand up, because all of you are impacted by climate change today, and all of your children and your grandchildren will be impacted tomorrow by what we do and what we don't do to address climate change. It's time to act.
Every color chair.
Yeah, there you go.
Absolutely. And Gina, we have some old threats that we still have to focus on. And you mentioned our children. Lead is still a challenge and still a problem for our children. And you really pushed us to take a public health approach to lead.
Yeah, because, you know, it always amazes me that we're dealing with sort of antique things like lead. How long have we known that lead is a danger? Since the early civilizations, they figured it out. And we're still talking about it. And one of the challenges of lead is it's not just about our water systems, which are important to look at, but in terms of delivering lead into our kids and hurting them. The challenge that we face is much more systemic than that. You know, we did great as EPA, I think, to get the lead out of gasoline and really make huge improvements in keeping it out of our air. The challenge we face now is that with the changing climate, you know, we have to invest in our water systems. You know, when you look at Flint, that wasn't just about lead. It was about old, aging water systems. It was about not having an economic structure to be able to support clean water being delivered, especially to the most vulnerable communities. And don't think that Flint wasn't about poverty and communities that were left behind with no voice. That will consistently happen and be exacerbated in a changing climate, because we know that public health impacts hit the most vulnerable first. low income, communities of color, those who are basically homeless, who are indigent, they're most at risk. And so we have to look at the built environment. You know, we expect that in 2050, we're going to have about 9.6 billion people. 2/3 of them are estimated to going to be living in urban areas. 75% of the buildings that need to be there to support them do not exist today. Isn't it time we look at where we spend most of our time, which is in our homes, in our offices, in our buildings? As we make them tighter to become more efficient, we're capturing all of the PFOS and PFOA and other flame retardants that are sitting in these products and exposing ourselves to them. We have to be smarter. We have to think about health as we think about climate. It is the most important lens for us to look through, and so we need to think about building differently, not just in our homes.
Right. And that's one thing that you did. Obviously, at EPA, we had our laws and we had our lanes, but you didn't stay in lanes.
No, I wasn't
reached out. Whether it was energy or working with the other departments.
Shh. No one will hire me. I mean, for crying out loud. No, I think bureaucracies, you know, the value of a bureaucracy is you have to focus in certain areas. But the best thing about a bureaucracy is actually to work together.
Yes.
Because everything matters. If I do something at EPA, it's going to matter to DOE. It's going to matter to HHS. All of those alphabet soup things need to go away when you're dealing with people's lives. They don't just want a job. They prefer to breathe. You know, and we need to stop thinking that these are dynamic problems that can't be reconciled and start talking about what people need, not what our bureaucracies need. And that means we got to get out of our own little closets.
Absolutely. And one of the exciting things about the Bloomberg Initiative is it's talking about the future and how we think about cities, how we think about communities, and the built environment, not in these narrow lanes, but inclusively, using tools like health impact assessment, which you have pushed. And that allows us to get public health at the table.
Yeah, it sure does. Well, I think the exciting thing is you have all of these reports that told us that we have real challenges and we have to act fast on climate change. But the interesting thing was that each and every one of them ended up by talking about the fact that we can do this. We know the science. We understand the technology. We have solutions that are readily available that if we all could participate and get access to those, then we can make this happen. What we don't have is political will. But what I see now with the federal government sound asleep on some of the most critical issues, the rest of our democracy is waking up. And Bloomberg is helping to support efforts at the grassroots, efforts in our urban areas to rethink, because we need to turn climate change, which is a tremendous public health problem, into the most wonderful public health opportunity if we think about all the resources that are going to be spent on climate, and we look at each and every one of them as an opportunity to invest in public health today while we move towards a more sustainable, healthy, clean, just future. If we just think like that, it's not a problem. It could be cold. That's what we got to do.
And Gina, I know the scientific community hears you, I know the public health community hears you, but the business community is wising up, and you provided incentives for them to move forward.
Well, I'm actually working for a public equity firm called Pegasus Capital Advisors in New York. And the reason I'm doing that is to try to learn the economic side of this. It's not a place where I've been comfortable. But the cool thing is that they just invest in sustainability and products that help with health. And you make money on that. So the business community is waking up a lot. So we have the structure in place that our country has always had to move forward. It's called every level of government. It's called the government of, by, and for the people. So let's make demands on those people. Let's tell our politicians who they can be that represent us, what they need to say, what they need to do. Let's do business with businesses that actually share our core values. We can make the world work again because we are the United States of America. Thank you very much.